audits, then we'll move into an update from Courtney. Before you all leave today, just Annette and I will continue reminding you all about next Thursday. It'll be your night meeting. We'll load you with information on where to go, when to be there. I'm not looking at any individual commissioners right now.
I am.
Maybe.
Directions?
You'll be getting
So,
yes.
Maybe.
So with that said, just a last reminder, Mac is out today, so our vice chair will be chairing the meeting. I'm going to sit back, just watch the presentations, and then we'll jump into committees, and then I'll join you all for the formal meeting. Thank you all. Happy Thursday.
Call this meeting to order. Anybody have electronic device, I'll put them on silent, please. Any materials that you may have, the public, give them to Commissioner Curran, he's the Sergeant of Arms, and they'll distribute them. Madam Clerk, please call the roll.
Bell.
Present.
Curran.
Here.
Freeling.
Present.
Harrison.
Here.
Engelmann.
Here.
Najaric.
Here.
Deeds.
Here.
Scott.
Here.
Ballrat.
Present.
Werfel.
Here.
Yarborough.
Present.
Elliott. Mr. Chair, you have 11 present, 1 absent.
Thank you. All the minutes for the meeting, August 5th. Are there any corrections, additions, deletions? There are none. I'm looking for a motion to approve the minutes of the August 5th, 2021 meeting.
So
Four? Four.
Who's the motion made by?
Bell? All those in favor?
Aye.
Opposed? It's carried. Public comments. Public will be allowed to comment 2 minutes. You need to state your name and where you're from. And we're gonna move on, I guess. The next thing is the scheduled discussion, which would be the senior center audit review from Linda Ellie. Eli, I'm sorry.
Thank you. Thank you for the opportunity to be here. It's nice to see a smile, isn't it? Thank you for the opportunity to work with the senior centers and the county on the audit of the financial statements. Look at my notes. The auditor's responsibility is to express an opinion on the financial statements. Because nonprofits receive public funding, there's a higher level of accountability. There are questions asked by the IRS on their tax form 990. There's a Michigan state solicitation requirement by the state of Michigan. They get a license to solicit for donations. Many grants ask for copies of the audit reports, and the county also asks for a copy of the audit reports. The purpose of the audit is to increase the public confidence in the financial statements. When we began this process together 5 years ago, the county had specific goals that they were looking for. They were looking for standardized content for quick and accurate comparisons. And by doing that, they wanted to have the same auditor for consistency and comparability. The same fiscal year end. When we began, 2 of the centers had a different fiscal year end than the other 5. They wanted a standardized chart of accounts so that the reports and the internal documents would be standardized. The county has developed that, and all of the centers have adopted that and have continued to use that. And that standardized chart of accounts serves as a base for development of their accounting system. The county also had an emphasis on certain internal controls, and they listed 28 of them in our contract. We've taken those 28 elements and turned it into a checklist that we've provided to the senior centers every year, and we've gone over that as a part of the audit And it's also been used as a tool for them to evaluate which areas they can strengthen. Together, in the last 5 years, a lot has been accomplished. In my opinion, the senior centers have made steady and continued progress towards these goals. Overall, we've lowered the overall average of all the audit comments for material weaknesses. We've increased policies and procedures at all of the centers. The average for all of the centers has reduced from 4 identified areas of internal controls needing improvement to an average of 0 this year. In the past, I've focused on and told you a little bit about different centers, and this year I'd like to tell you about the progress that's been made at the North Berrien Senior Center. When we began with them, they were not registered with the state of Michigan for the license to solicit, and immediately they recognized that and applied for registration with the state of Michigan. These are the policies that they've added since we've begun working with them. Accounting policies and procedures. They've updated their bylaws. A capitalization policy, conflict of interest policy, credit card policy, liquidity management policy, updated their mission statement, written personnel policies, purchasing policy, records retention and destruction policy. So a lot has been done that maybe in the past, the commissioners have said, what don't we see in these audit reports? And that's just one example of one of the centers. Another thing that you may not notice too, a byproduct of this multi-year professional relationship is that the directors and the board members have developed that professional relationship with our firm and feel comfortable in asking us specific questions. They present, this is what we're checking. How can we do this job better? What should we be looking at? And that's another added benefit of developing that professional relationship. Every year we've given the centers tools to aid them in understanding their financial reports and helping them do their financial oversight in a more efficient and effective way. We started out giving them the checklist that we developed from your 28 items. We gave them a fraud self-risk assessment tool, and we provide that every year for them to reevaluate their fraud risk. We give them a segregation of duties worksheet so they can see what personnel are doing what areas and what areas may need more oversight. We developed a financial review checklist of the top 5 things that we'd be looking at, including at how to look at their financial reports to know if they still match the audit report. This year, with COVID, we expanded the use of our digital secure portal file, which is our tool for sending, receiving, and sharing business files securely online. 3 of the centers contacted us early last summer and said, we're shut down. How can we help prepare for the audit earlier and start working on that, since we aren't able to have patrons in and do as much programming as we would like. Central County, St. Joe Senior Center, and the Niles Senior Center are the 3 centers that contacted me early on, started that digital process, added their audit oversight committee members, so the audit oversight could then see the documents that were submitted, view them, be involved in all the discussion as in the past, but also see those digital documents during that process. In the past, we've talked about the fraud triangle and how to reduce fraud, and part of that is increasing your oversight. As the centers increase their oversight, they strengthen their internal controls, and that reduces errors and reduces opportunities for fraud. All of the centers have made significant and continued progress in that area. Included in your digital packets that should have been distributed to you is a summary of the audit reports. So I'll go over a little bit of that. All of the centers had a clean, unqualified audit opinion. They all were provided with audit journal entries as part of the audit process to adjust their books to the audit report. They've all filed their corporate filing within the state of Michigan for the past year. Their federal tax form 990 has been completed, filed, and accepted by the Internal Revenue. Their Michigan solicitation license is currently filed. They've all implemented the new chart of accounts that the county developed and are continuing to use that. And then I also just wanted to acknowledge the 3 centers that have expanded their audit oversight through the digital process that was provided to them, even though it wasn't required. There's a couple centers that we had comments on that are still working on specific areas. Benton Harbor, we would like to strengthen the internal controls by a little bit more segregation and oversight in specific areas. We also discussed the payroll tax payments being late in certain incidences and separating the bookkeeping and check signing function, since that's not a good internal control to have the same individual doing both of those functions. We talked to Benton Harbor about checks received, not receipted. And then Buchanan, we talked to them about payroll tax payments being late and discussed their retirement plan and gave them some opportunities to improve areas there. In the next section of the summary, we talked about the internal controls of the 28 items that the county is looking for. The first 2 items, I'm just listing how many have updated those 2 specific areas of the bylaws with the purchasing policies. Some of the centers have implemented written policies, others have actually updated their bylaws. The second item, I'm also showing whether the bylaws have been updated or they've adopted a policy regarding disbursements not approved prior to disbursement. Buchanan is working or has already implemented the checks not returned to the center. That's been a challenge for the centers based on the ability and of their financial institutions. So that has been a longer process. Then we talked to Benton Harbor about deposits not being made in a numerical receipted group and disbursements needing a dual signature separate from the person who's in the accounting function. So we'd like to see more oversight with Benton Harbor. Then at the bottom this year, we've added, just to show the average of the progress that we've made, the average from when we first began tracking these internal controls and where the centers were at, had an average of 4 to the last year having an average of 0. So I'm very pleased. I hope you are too. Are there any questions or comments?
Mr. Chairman, I'd like to, hello.
Hi, Mamie.
I'd like to know, do we have a set of what you're looking at?
Yes.
Yeah,
Is it in our
it's in
mailbox?
our box, yeah.
Okay.
Digital. I know you like paper. I do too. I do look at it.
Thank you.
You're welcome.
Yeah.
I just want to understand the action plans for those missed, where like the payroll, the oversight, what are those action items and have they already corrected them and have additional oversight since the report was from a lot earlier this year?
Right. Those centers that should be providing corrective action plans that's submitted to the county and monitored by the county. It will also be followed up in this current year's audit.
I'll put a question on. How did this compare this year compared, I know, how did this year compare to last year's audit? A lot of positives in the change.
Yes. Yes, I would say the centers in overall are embracing this procedure more. They're familiar with our firm and how we conduct the audit. They're familiar with what we're looking at. They're more familiar with me as they get to know me better. Like I said, I think the professional relationship there, they ask questions more freely. A lot of the centers just right up front say, we welcome you and we're looking to hear what you have to say and we want to make improvements.
I know that because I was here and, we had to shut it down. That was a little tough.
It's a process, and it's been a lot of work for the centers. You have to acknowledge the whole audit process in itself, the implementation, the additional checklists and that sort of thing that they're going through. But I also do believe they understand the benefit and the reasons behind that.
I think as long as they're doing the action plan, and looking at their timeline for doing it also,
Right.
I think that's a big motivator.
Mhm.
Any other questions? Seeing none, thank you so much.
Thank you.
Pleasure
Thank you.
to hear from you on the senior center.
Thank you.
Yes.
And the fact that it's 5 years.
Yes.
Really fast. So glad to see standardization. That's a word.
Yes.
What they're doing. We have 7 directions.
Yes.
Where we're going.
Yes.
Thank you.
You're welcome.
Okay, our next presentation is from Courtney Davis, our Marion County Interim Health Officer, COVID-19 update.
Right, good morning. I will be a bit more brief this week. You heard the large update last week, so this is just to kind of bring us up to speed on where some of our data has moved over the last 7 days. So I won't read these again, but just want to, again, kind of keep us focused on what our goals are. And I know you all have access to these slides as well, but continuing to focus on those as we look at our data. As we look at our daily positive test rate, you'll see that over the last couple weeks, that has continued to increase, with the last week really continuing to jump up. This is looking at a daily. When we're really making those decisions, again, a trend is really important. We're looking at that 7-day average. So that's at about 7.9% for our percent positivity right now. When we look at our daily cases, a week ago when I was here, our number was about 8.9 cases a day that were coming into our department that required case investigation and subsequent contact tracing. That number is now closer to 18 this week. So that has increased a bit more rapidly than we would have liked to see over the last handful of days. So we're closer to that 18 per day. That is of confirmed cases. That is a little bit higher if you add in probable and suspect cases where we're waiting for those results, or somebody is a close contact and exhibiting symptoms. Yes.
Okay, the daily positive test rate, is this, people that become, or test positive that come in, or what is that?
Yep, so this is out of all of the tests that are done for COVID-19, this is the number of people who test positive. So the numerator is the number of people who get a positive test that says you have COVID-19. The denominator is all tests overall.
And Courtney, that's any provider giving tests.
Yep, that's any, and this would be for Berrien County residents. So even if a resident is tested outside of our county, we get that information. Yep.
This is not just the health department test.
Correct. Countywide, all providers. Yep.
And I'm going to ask a follow-up on that.
Please.
Sorry. And does that include then people that need a negative test to go back to work, and they have to come every week after they've gone past the disease and they have to get a negative test? And maybe they're still testing positive? Because they can test positive, from my understanding, for 2 to 3 months after.
Yeah, that should not be in there. They would be, though. Anytime you're tested, you're going to be in the denominator. But if you had COVID
still
and
testing positive,
correct, because we know people can test positive up to like 60, some words up of 90 days post-infection. Yeah. Okay. All right, so again, we continue to monitor our deaths. No changes here. We have not had deaths over the last week. The one thing that I know we've talked about and will continue to watch is the state still does do every 30 days the death certificate review. So that was the last time we saw that increase there. Again, we saw this last week, but you can just kind of see month to month where those deaths are landing. And this is actually the dashboard. So one of the things that we're going to be doing is the health department has maintained a dashboard with now the data that is available at the state level and at the hospital. Our dashboard is just not keeping up with that data. We're going to be doing some updates with that and try to have more timely and relevant data on our website. So I do want to start to draw in where the hospital is actually reporting for us right now in the hospital. As of this morning, when I looked, we did have 0 in the ICU. We did have 12 positive patients in the hospital.
So then is there a number, I'm sorry, is there a number then just ICU patients that can be in there for a heart attack or other?
So this top box, this COVID-19 patients in the hospital, that is specific to COVID. The hospital volumes is the hospital as a whole. But one thing that has been important to us is we're really we're looking at hospital capacity. We don't want someone in there for COVID-19, but we want to make sure as a whole the hospital is operating. So yeah, just the top box though is COVID specifically. All right, so I'm going to talk about this slide for a minute. We talked about the CDC Indicators and Transmissions last week, that is one of the metrics we are looking at as we make decisions moving forward. What I really want to highlight here is there are 2 sources to get this data, and basically it's a timing difference. So there is the CDC data tracker that I know a lot of people are going to that get data from the state, and those are our estimates. What I would really encourage us and want us to be looking at is our state and local threshold. And so I did want to point that out today. Moving forward, what we're going to really look at is our 7-day trends of state and local data. That is more timely. It's more accessible to us in that real-time decision making. But I did want to note, because this does come up, that yesterday when if you looked at state and you looked at CDC, we did have a slight variation in our rate of transmission. So today, if we look at our state and local, it's at 82.1 per 100,000. Our percent positivity, that number is a little bit more stable between the two. Will usually match, is at 7.9% positivity. Both numbers are correct. It is truly a timing and when those data dumps are made. But it's important, I think, for us to have the most timely data. So we're going to be really looking at that state and local threshold. This is what we're working to get up on our website so that our community residents have an idea of where we are in Berrien County and how that compares to the state. So with that, this is just the graphical representation. I'm going to go over that. So this is that same trend. So we're looking at our internal trend. This is on state and local data. We have, as of last Friday, you'll see we have steadily moved into substantial transmission. The reason in the percent positivity column you don't see that calculation is the state is able to provide that to us on a daily basis. We don't get our data dump, if you will, to do that local calculation until Thursday. So that will come into our department today. We'll be able to make that same calculation, confirm that with the state. That's the only difference there. However, we have now seen about a 5 to 6 day trend of being in that substantial. With the cases coming into our department this week, we are continuing to see that hold steady and unfortunately expect that to increase as we move into the upcoming days. Again, still important to really look at how our vaccination rates are wrapping around. So our 12 and older is 54.7%. We are seeing an increase in demand for vaccines, so that is really good. Our clinics the last couple of weeks, as well as partner clinics, have been able to communicate to us that they have been seeing more people coming in for vaccination. We're going to continue to encourage and increase that. This is just, again, that density map where we can look by zip code. This is for 16 plus. When we look at this, week over week, we're not going to see huge changes in this, but we are looking at this at the census tract level. This is what allows us to really identify where we need to be spending our time and really identifying what those barriers are to vaccination. This is another way we're able to look at vaccination rates from the Michigan Safe Start map. Again, it just shows us daily vaccine uptake. We're also able to look at by product, first dose, second dose. just for points of reference, if we're looking kind of towards the very, very end of this, the last 3 bars, one is the 8th. That would be 147 vaccines were given on the 8th. It was 94 the day after. And then on the 9th, the last day on this graph was 35. So you can kind of see that fluctuation of vaccines. Again, this can help us identify, is there a day that's working better? Is there a product? And again, hone in on vaccination in our community. So this is just a reminder, as we are looking at that data, this is what it's spanning across. We're looking at that community transmission, what we're seeing. We're continuing to monitor hospital capacity and what they are seeing. We have seen slight increases there, but nothing has crazily jumped at this time. So that is really good. Our vaccine coverage, hopefully this anecdotal knowledge that we've had more people coming in for vaccine is going to come through in our rates, and we're going to see that higher vaccine coverage. Our case investigation, we're really watching that closely. It's important for public health to do meaningful case investigation. So as our cases increase, aligning our team to make sure that we're able to keep up with that and break that chain of transmission. And then our populations at risk. So really making sure that those who are currently vulnerable have that layer of protection, but also really keeping an eye out for, has any of that script changed? Has anyone else kind of crossed into that vulnerable category? So with that, please.
What is population? What am I saying? Wait, so it's not kind of test.
Before you respond.
Go back to that.
Hold on. Let me.
Members of the board, I'm just going to ask all of you to remember to use your microphones. I've already had a couple of texts just come through saying they couldn't hear you when you ask questions. Thank you.
That's what I want to understand.
Yeah.
What is that in the chest? And who is the population risk? We all are.
Everybody is at risk when we think of vulnerable population and who is at increased risk with COVID-19. That has been our elderly, our immunocompromised, and those living in a congregate setting, especially right now with Delta, that is much more transmissible, right? So those close quarters. Yes, and we all have a risk to COVID. Some have that increased risk, and that helps us make some of those decisions as well.
Thank you.
Absolutely. All right, so what has really caused some of this increase in change? We've had the script, we've been moving forward with our response. The Delta variant is really where we're seeing some of the impact and where some of our recommendations, our data are showing that some of those recommendations need to evolve and change. We are learning that the Delta variant is more contagious, quite a bit more than other variants that we have had in the past, able to spread much more readily. When you have higher transmission, you will inevitably have higher illness, severe illness, hospital impact. We're seeing that in other states across the country. We still are seeing that vaccines work to protect against the Delta variant. But most importantly, what vaccines are protecting against is severe illness, hospitalization, and death. We are seeing a lot of success in that, and that is a really good thing to continue to have as we promote vaccines, make our decisions. We are seeing that if you had the original strain of COVID-19 and are not vaccinated, you do have a heightened risk of getting Delta. The vaccination is able to build more antibodies in your systems to protect against new variants as they come forward. When you've had more of that natural immunity, you don't have all of the same number of antibodies. So really, if you have had COVID, our strong recommendation is get that vaccine. It is going to add the layer of protection you need against Delta. And then right now, with that knowledge that we're learning about Delta, continue to learn, vaccination and masking really have risen to the top as our best lines of defense to slow the spread. So in that population health model, really being able to flatten our curve, prolong that rise as long as possible so we can get more people vaccinated. So what this is all coming forward with, now that our community has moved into that substantial category from public health, we really do need to update our recommendations out to our community. So forthcoming guidance and recommendations out to our residents will be a recommendation to wear face coverings, face masks when you are in indoor spaces. that will be regardless of vaccination status. We just want to ensure that from a population health standpoint, from a community health standpoint, that we are recommending that layer of protection. And then a reiteration of all of the other things we know have been base layers of prevention and mitigation in that work. The vaccine, promoting that, hand washing, physical distancing where feasible, the face mask when you can't, stay home when you're sick, and then of course isolation and quarantine. As transmission increases, we really want to make sure that we're breaking those chains. So these are some of the updated recommendations that will be coming out from the health department as we continue to learn more about Delta. As hopefully we can see our curve come down, not increase, we'll be able to continue to update those recommendations. So that is the update that I have. I'm happy to answer questions, but did just want to make sure that you all had the most up-to-date data that we were seeing. It has changed a little bit since last week, so wanted to make sure that you had that knowledge for your purposes.
Any questions for Court? Comments? All right, thank you. Is there any other business that we need to discuss here this meeting? If not, we can adjourn.
Wow, that was fast. Jeez,
That's great.
just done.